Okay, right,
We
thank
still
you.
have 2 minutes. We still have 2 minutes before, yeah, like 30, but I'll be back in here if you need help.
Okay, great, thank you.
You're welcome.
Or did you just pick it up from there? It is 8:30.
Okay, we're still getting some people finally in.
Is it the Mali that's the Mali?
This mute.
Yeah, it's. I think you have to put it on, but you need to hold it.
Hello? Is this working? You can hear me? That's a good sign. Good morning and welcome to day number 2. Congratulations for being here on the first session of the day. Yeah. Thank you all for being here. My name is Yasmin Reyes. I am the research manager for the Water Health and Development Program at Stanford University. And I am going to be moderating today's session, and I will be introducing our speaker today. We have with us Mr. Mohammed Bab. He is the head of monitoring and evaluation for the Water and Resources Ministry in Sierra Leone. We're very lucky to have him here today. Thank you for being with us. We also have Mr. Can you help me pronounce your last name, please? I want to get it right.
Falcon.
Matthew Falcon. He's a research PhD candidate with the National Science Foundation Graduate Research Fellow at University of Colorado Boulder. And his research is focused on monitoring and evaluation of water supply intervention in Sierra Leone, and he's going to be talking to us about that today. So a little bit of framing to let you know what we're going to be talking about today. A lot of the work that we all do is around generating knowledge and information that informs decision making for and behaviors as well that contribute to sustainable outcomes. To the extent that we can, we also want to support LMIC to build up capacity to collect high quality data that will also enable them to make effective and evidence-based decisions. And making these data available is also crucial so that these decisions can be made in LMICs. And there are some really good examples out there of these initiatives where data are made available. For example, there is the UNC Dataverse that allows you to store and publish data and make it available for people to use and make decisions based on that. However, it's important to note that all of us respond to our own professional motivations. Right? Yeah.
They want you to go to the podium. I think something with the live audio.
Oh, okay. Sorry. I'm going to move. And I'll leave these for you to use. Thanks for letting me know. So does that mean everyone needs to come here as well when they're presenting?
I think so for the camera,
Okay.
for the live stream.
Okay, as I was saying, we all respond to our own professional motivations when it comes to collecting data. So for example, in academia, the objective is publishing a paper, right? And oftentimes that's where the work ends. That means we have to collect data based on that, on the timeline of a PhD or a master's degree. That means that we also collect data that the government often doesn't collect. We need the data to be organized in such a way that allows us to draw strong scientific inference. In other words, we are collecting data that are not translatable for others to be able to use. And I believe that most of us, if not all of us, are guilty of following our own professional motivations without taking into account how these data can be used otherwise. So let me give you an example of my own work and how this has happened to me in the past as well. Back in the day when I was working in India, one of the things I was doing is setting up some latrines for indigenous communities that were at the time doing working with doing open defecation. And so we showed up and we're very proud to have this survey and say like, well, you know, we're gonna make sure that this meets their needs, and we used all the very strict methodologies for survey design and, you know, top-notch sort of academic design survey. Turns out we built these latrines based on what we thought was needed. No one used the latrines. And so I go back and I'm like, okay, where did we go wrong? You know, we collected the data in like following all the advice, following all the high quality recommendations. And I started talking to people and they said, well, you know, someone came and did a survey and they collected information about practices, and they told us, and we told them that we go to the bush. And so they thought it was a good idea to build the latrines in the bush because that's where we go and we would feel comfortable. Turns out the latrines became a perfect cobra nest in the bush because they're nice and warm and dark, and nobody had thought of that. So we realized, well, it doesn't really matter how well we design a survey if we don't take into account sharing the data and sharing the decision making when it comes to designing that survey as well, and bringing back the data to local decision makers rather than imposing what we thought was the best way of doing things. So as we, throughout this session, I would like you all to connect with your own work. And I would like the audience to think about these two main questions so that we can come up with a very fruitful conversation at the end, and constructive conversation after the presentations. How can we as international institutions invest in strengthening a culture of high quality data collection for decision making in LMICs? And also, what can you do in your current role to be able to address the misalignment of motivations for data collection and use? So as we think about that, I would like to invite our first presenter, Mr. Mohammed Ba, please.
Good morning again. I'm going to present to you the work we did in Sierra Leone based on our policies and looking at the challenges in terms of implementation, what we plan at the national office, at the national secretariats, and what happened at the rural levels. So we try to look at that and what really will bring that differences we'll find out. So that's exactly what I'm going to present to you today. Based on our policy and based on the implementations, what are the differences? What really happened along the lines? Are there issues that really happen along the lines? What are the faults in that process? So that's exactly what I'm going to present to you. We believe with the assumption that data will really bridge the gap between the policy formulation and the practice. Because what we realize in the water sector so far, we have some nice policies and we made a lot of investment in the sector. We planned, we met in the various forums to really put a lot of investment to the water sector. But what the results we are having, it's so much poorly. So we're having some of this issue every day and day. So we realize that these are the issues. So, but if we have real information, real data in the process, we believe that will also guide us. So with the assumption that data will really guide the process, will really reach that gap. So that's why we look at the data joining in Sierra Leone for us to really reach that gap in the sector. So I will take you through the data joining with in Sierra Leone and also the partnership with the WPDX. Because when we are collecting data, we also want to make use of the data. And what are we using the data for? What is the purpose of the data? So we partner with also WPDX to really help us in doing that. And we partner not only WPDX with other universities like Colorado Boulder University, Stanford University, and other universities to also help us in making use of the data and making a deep sense from the data. So that will help us to really address the gap between the policy and the implementation. So first, I will take you the current status of the investment in the water sector. As I said earlier, there are a lot of investment in the water sector across the country, investing in constructing a water point, but most of those water points are not functioning because of implementation issues. And we make some nice policy, making sure that whosoever implement a water point should set up a wash management committee, making sure that this wash management committee taking care of the rehabilitation, taking care of the management of the water point. But are these things happening? No, they are not happening. So that's why we have 40% of our water points are not functioning across the country. And also, a lot of NGOs are rehabilitating water points. Which water point are they rehabilitating? What is the essence? Are you rehabilitating this water point rather than water point A rather than water point B? So which decision really guided to really make that decision? So the water point data we collected in 2012 and 2016 guide us in really informing actors in terms of making short decisions of which water points you need to rehabilitate rather than the other water points to rehabilitate, based on parameters, based on evidence base, based on the population of the water point that is covered. Because our target is to reach more people. And if we want to reach more people, we don't need to rehabilitate a water point because my friends or because my family is within that community. It's because that water point covers more populations. So that's exactly what we use the water point data to really guide us in that. We link that with the population of CLU to really support us in that. So that's exactly what is happening. And so far in 2012, our first water point mapping data we collected, we have a huge challenge of that. Sorry, so I'm still getting affected by cold. Sorry about that. The 2012 water point data, we have a lot of challenge with that. We are not using a web-based system. We use a paper collection system, and we are in the data. It was not well accepted by the stakeholders, and also a lot of the parameters was not really aligned to the strategic plan of the government, and also with international best practice. So it was not fully accepted. But what we did as a government is to really look at those challenges we have in 2012, to really address that in 2016. What we did is for us to really move from paper data collection to really a web-based data system, wherein we capture most of the coordinate, most of the information that will really be acceptable, and where that an immigrator will not go to his office or to his house, just collect data. So we'll collect information like coordinate, picture of all the water points in that system. And before that, also to make sure that everyone is participating during the process, we call on a consultative meetings of all stakeholders for them to agree on the framework. So we agree on the framework that this is what we want to go. This is how we want the sector. And that's exactly what we did. Everyone is accept the process. We move forward. In moving forward, that we collected the data. We collected a very huge data, which about 1,704 water points across the country. We map all those water points, and then we have this data. How do we use this data? It was a very difficult for the ministry. So in that process, we partner with a lot of our colleagues, WPDX, with the universities, to really help us in analyzing the data, to really help us making use of this data. So we analyze this data to answer some critical questions. Which water points you want to rehabilitate that reach more people? Why are you rehabilitating this water point? Where do you want to construct a water point? So we link this data with the population of CLU. It helps us to really answer these questions. So that's how we move forward in the sector. So today, also the Ministry of Finance and Local Government and Rural Development also using this data to really relocate resources to the district councils. Because in our country, we have the devolution process where in the central government and the local council. The local council are responsible for the implementation of rural water. So the resources from the central government is going to the local councils. So the Ministry of Finance is disbursing rural water supply funds to the local council based on the population size. So before they were doing that, just the number of people they have in that district, without knowing the number of water points in that district. So in essence, if a district has more population, they have more money. So the other district that don't have the resources, don't have much population with a difficult terrain, they are ignored, they are left over. So the data also help us to address that challenge. So we provided the data. So okay, this district is, the population is less, but they don't have functional water point, they don't have water resources, they don't have a water supply. So look at that population, look at that figure, and then you prioritize your resources allocation to those districts. So that's so far what we have been doing to really address the issue of the disconnect between the policies and the and the implementation. So we are using this system of really identifying the key areas where we can invest more rather than where we can just do that because based on friendship or based on assumption or based on a political ideology. Let me give you an example on what happened in a particular district in our country, which is Bo District. Bo District is a central district, is the second city of CLU. They have a lot of functional points within the central of Bo, but interior of the district, there is no water supply. So when they mapped the water point in 2012, they realized that there are over coverage, which was not true. So what happened? The 2016 data revealed that and shows that the interior of the Bo district, they are really suffering of water supply rather than the city of Bo. So in terms of now prioritize, instead of focusing to the city of Bo, we need to move our investment to the interior, to the rural of Bo district. So making sure that the rural gets more service than the city than before, because the city is where everything is clustered. It's where you find the directors, the ministers of everything. And so everything was really concentrated to that part. So instead of doing that now, we say, hey, look at the data, look at the evidence, look at this. These are your people, they still need the support. You need to go there. So we try to bridge that gap. So that's exactly what our study revealed, that the data really help you to bridge this gap in terms of this, what you develop at the national level and what is at the district, at rural settlement. All this, what we have done, we still face a lot of challenges. And well, one of our biggest challenge we still have is this commitment at the top level. We all, you will agree with me that still we see data as something that will expose wrongdoing. And for us in Africa, we don't want you to tell me, hey, Mohammed, this is wrong. I just want you to tell me, hey, Mohammed, everything is fine for you. That's what I want. Well, but this is wrong. So we still have that commitment. We still have that challenge within our political leadership to say that, to say, hey, your plans, what we agree is wrong, so support the data information, data collection, data management system. So we still have low commitment into this. We still have that low level of supportive to data collection. So that is a very big challenge we are having. Of course, the government to support data collection will say, yes, we are supporting this, we are doing this, but we are not doing that. It's very low. We are not getting that support to really see that this is a continuous process. This is something that is I own, this is something I need to do in a regular day, week, month, yearly. We are not getting that. So since we are not getting that, it's a very big challenge. And also, the system we established is also for us to get data from our partners, making sure that if we get the data, they have their own project, they have their project. We set up a country-led monitoring system that we want it to work. But since we have challenge from the central government in supporting this process, let us use another route. The other route we want to use is to get the data from our partners. Since they have their projects, they have funding. Government is not supporting us. So let us use the donor, the partner, to support us in getting this data. When we get this data, we'll use this data to really provide this evidence. But that's also another big challenge. As partners, some so reluctant in getting it. And one of the critical data we are not getting from them, especially on financial tracking, but also to get the budget on especially the expenditures in Wash. That is also a very, very big challenge for us. Sometimes they will say, oh, Mohammed, I have now some water points here. Look at the data. Okay, that's fine. But I also want to know exactly, what is the investment that has been into the sector. And the last one, which is very, very, very big challenge, this of the transformation. This one, I always say, like I said yesterday, attitudinal change, this transformation from this result-based monitoring to a result-based monitoring. We have a system wherein people just say, oh, okay, we have some money for monitoring. The permanent secretary, the director, the minister, and call Mohammed, let us go for monitoring. We just look, oh, this work is going fine. This is going well. Okay, everything is going fine. Okay, let us move back. So sometimes we look at ourselves, is that monitoring? Is that what we think that's monitoring? So when you want to do the monitoring, put up a plan, put it, then we look at, okay, let us wait. We'll go, don't worry, we'll do the monitoring. So at the end of the, maybe the middle of the project or the end of the project, when there is a pressure somewhere, either from donors or from other quarters, they say, okay, let's go for monitoring. Or maybe the accountant identify, oh, okay, there's some money here, this money is for monitoring. They say, oh, okay, call Mohammed, call his team, develop a concept note, let us do that for monitoring. So even when he pushes, say, no, this is not what we need to do, it's also a challenge. So that's one of also challenge, transformation. But if we want to really make use of the data for decision making, one of the things we need to really consider is really to make sure that the parameters are aligned to the strategic agenda or strategic plan of the government and international partners. If you really align all your parameters, you don't collect data just, I want to collect data for data's sake, but make sure that the parameters is aligned to the strategic plan of the government. That will really make sure, that will really help you in making the data usable. And of course, the quality of the data. And as I said earlier, the data strategic alignment. The data need to align with the strategic plan of the government. And also, now we talk about the SDG. You need also to align all those things and the managerial commitment and the use of data. For us, we have an annual WASH conference annually. And this annual WASH conference is where I always share the need, the essence of us to invest more on data, for us to really pay more focus into data collection, data management, and data investment. But as a developing nation, it's still a challenge, but we are pushing, we are making more advocacy for us to receive the leaders to see that it is necessary for us to invest into data management. They are aware, trust me, they are aware, they know that, but it's a challenge. But we are trying to really for them to accept that. And that's why we are still continuing to exploit the opportunity for them to agree that we need to invest into data management that will help them to reduce the costs. If you don't, you will spend more in terms of constructing water points. You as a politician, you want to construct water point because that's what people will see you that, oh, you have done so much work. But you will spend less if you focus on data to give you more results than just to rehabilitate, just to construct water point. So those are the message we have been passing around, that instead of go just construct one or two water points in a particular district, then you make what we call puppy show. It will not help you. But if you focus on data management, invest in data, you will do more of water points than those 2 water points you have constructed. So far, I will end my presentation here. Thank you.
Any clarifying questions that we have for Mr. Ba at this point of his presentation? We're gonna move on to a discussion later, so if no one has any. Yeah,
Hi, I'm Matt Bentley from USAID, Bureau for Humanitarian Assistance. I was just wondering, what percentage of the water points do you think you have in the tool at this point? Do you think you've reached 95, 100% of the water points included in the tool? And what strategies have been effective at getting data from partners?
All right. We use the tool to capture all the water points across the country. So it's 100% captured by the tools. And the strategy we are using to collect data from the NGOs is to really make sure that when they are signing the renewal document from the Ministry of Development and Planning, is for us to capture that process during that signing ceremony. Okay, so now we have institutionalized a service level agreement with them. So whenever they are signing this agreement, so we capture that. So you need to share the data. Yeah, so that's what we are pushing forward to them.
thank you. Let's move on to our next presentation so that we can have a discussion after. There's a few.
Jasmine?
Yeah.
Do you know what the second presentation is?
Yeah. Yeah, it's just under the.
Hey, everybody. Thank you for being here. As introduced earlier, my name is Matthew Falcone. I'm from the University of Colorado Boulder. And today I'm going to share with you a little bit about our collaboration with Mohammed Ba and the Ministry of Water. We kind of had a roundabout way of coming together for this partnership, and there were a lot of things that we did really well and a lot of things that aligned with the Ministry of Water's initiatives. And I'm sure a lot of things that didn't. So we could talk a little bit more about that as we go. So I really want to focus this presentation on thinking about it as a case study of how we work with the ministry and how the ministry worked with us, and keeping it brief and focusing on the partnership rather than the results of this specific project. So I'll give you a little bit of context of the water service delivery in Freetown, Sierra Leone, where this project was completed. Talk a little bit about the intervention that I was there to evaluate, and then just discuss kind of this partnership as well. So to start, and Mohammed gave a little bit of context on this, but Sierra Leone is a small low-income country in West Africa. It has monsoonal seasonality, so half the year there's a ton of water, half the year it's not a drop. But there's a high burden of wash-related disease. So it makes sense that there should be a lot of investment in this country in terms of wash related services. In particular, Freetown has a population of 1.8 million people. There's an existing pipe water network, but it suffers quite a bit from a lot of infrastructural problems. So the result essentially is that there's not strong water access, nor is there strong good water quality throughout much of Freetown. So between intermittent and insufficient water supply and pipe water network, broken infrastructure from pipes to reservoir issues, even just to the network extent, the network of the Gouma Valley Water Company pipe water network doesn't extend throughout all of the service areas or all of Freetown. Furthermore, alongside a lot of these issues, there's a lot of contamination within the pipe water network. And when collection occurs outside of the household, there are a lot of people, especially the low-income groups in Freetown, can't afford connection to the pipe water network. They still have to go collect water. So even if the water they collect from the system isn't contaminated at that point, it may be by the time that they collect it, transport it home, store it, and by the time they use it. So to introduce kind of where this project came from, the Millennium Challenge Corporation is a United States bilateral foreign aid agency. And they invested recently in a threshold program in Sierra Leone, part of which dealt with the water issues in Freetown. So between the Millennium Challenge Corporation and its coordinating agency, the Millennium Challenge Coordinating Unit within the Office of the Vice President of the Government of Sierra Leone, they put together a project with many components. And one of them happened to be the project that I was asked to do some monitoring evaluation on in our research group. And that worked with the Gouma Valley Water Company, which I just introduced a moment ago. It has a large mandate to serve a large number of people, but is lacking in infrastructure and working functional infrastructure that prevents them from being able to do so. So the University of Colorado Boulder was pulled in through a cooperative agreement with MCC to do some high frequency monitoring on the water kiosks, which I'll introduce in a moment, to understand how functional they are in terms of supplying water in some high need areas. And then we sort of expanded that scope outside of the cooperative agreement to better understand and evaluate that intervention beyond sort of functionality monitoring. And that's where we pulled in the Ministry of Water Resources, coordinating with Mohammed to do water quality section, essentially a lot of data collection and adding context into our work. So here's a picture of the MCC water kiosks. 10 of them were installed in Aberdeen and Kington communities in the north of Freetown as a pilot program. So the idea here was, instead of installing hundreds of these across the city, which is likely the need in the city of Freetown, to install 10 in 2 communities to test out how well the system works, and from there decide further if the system should be expanded or replaced with something else or another option. So the way the kiosks work is there's a water storage tank where water is filled into the storage tanks through either the piped water network while it's not rationing in those communities, or filled with water trucking, which is really supposed to be more of an emergency response. MCC funded this project, so these 10 units. Gouma Valley Water Company would provide long-term maintenance and water supply, and private operators would conduct operations and service.
Just a quick is it treated in the tank?
It's
The water quality is.
Yeah. So it's treated, the water is supplied through the tank or bypassed around the tank, and then is treated through filtration and chlorination in the actual kiosk structure, and then is sold to customers.
Thanks.
So to frame this a little bit in terms of a theory of change, on the left-hand side, we have the inputs and activities of actual, construction of the infrastructure and maintenance of service. Then towards the output level is where we were asked to monitor. So the question really here was to ask how well do these kiosks provide water? How often are the tanks full? How often are they actually able to be a source of water for the community? We push this out a little bit further to look beyond monitoring into evaluation as well. So we were able to leverage some additional funding to be able to get a better, more thorough understanding of how these water kiosks were working from a functionality point of view, as well as effectiveness and further out. So that's a project that I'm talking about a little bit today, really that study and how we partnered with the ministry. So to give you a little timeline, this was a recent project. It was kicked off in 2019. Kiosks were built and constructed during 2021, and then we collected baseline data before before kiosk became operational in 2021, and continued through 2022 in data collection. So the main part of data collection had two main parts. There was a household survey and household water quality testing. So essentially, we were trying to figure out how well did the introduction of this intervention impact people at the household level. So beyond the point of collection towards the point of use. So the household survey included household demographics, poverty level assessment, water source preference and use questions, water collection and storage. And our primary outcome in terms of water security was measured through the household water insecurity experiences scale. And that is a series of 12 questions that really try to dig deeper into the lived experiences of people that may or may not be experiencing water insecurity, which is a bit more interesting and possibly more impactful than looking at, for example, volume of stored water or simple measurements. In addition, we collected we conducted household water quality testing. So we looked at E. coli and total coliforms by collecting samples using Aquagenics compartment bag testing, which picture is shown there. But we also did some light physical chemical testing in the field, including temperature, turbidity, and chlorine. So one interesting, useful thing that came out of this work was the trade-off between us and our colleagues at the ministry in terms of contextualizing the work and developing the right methods, or really adjusting the methods that I had so brilliant written towards something that was more actually useful with supplies that were available in Freetown and available to the National Water Lab. So that's what was useful on our side, but then there was also some skill transfer back. So we did regular check-ins during periods of data collection. We had meetings with the whole team, the enumerators and the water quality technicians, and we're able to kind of identify small challenges and address them, including, some of the sort of typical things, bias in asking questions, or cross-contamination between samples. So we were able to identify challenges, address them, and conduct capacity building in that regard. Here's some aggregated results from those tests. So our two primary outcome variables are through the HY score for water insecurity and E. coli risk through compartment bag testing. And so what we found, which really was not terribly surprising, and Mohammed knows this better than me, that there's a lot of water insecurity in Freetown, and there's pretty bad water quality at the household level. But as Mohammed had mentioned earlier, that data isn't always readily available to the ministry. And I remember during a rainy season data collection that there was a point where Mohammed told me that this data was very useful to the minister, was very interested in this data, because although data, a lot of household water quality data is collected during periods of, outbreaks of waterborne disease, cholera and, Ebola. But it's not always consistently collected. There's not funding all the time to continuously collect data. So although this was a secondary output of this work, it was actually very, very useful. Which sort of highlights the fact that, we were conducting our own work, essentially using the ministry as a partner, but it was a different goal. Yet being able to tweak some things and collect data during different periods of time within our own methodology was useful in a different way to our partnering agency. Just something to think about there. So before I start closing out with this, I kind of want to talk about, our future work here. So we're completing this impact evaluation, which I'd be happy to share much more detail at a later time. Or you could read my paper in a couple of months, hopefully. But we have a locally partner agency. Mohammed will be a co-author on that work, and we plan to share that data to relevant stakeholders in methods beyond just publications, which we know are not always super accessible to implementers and government agencies. So we plan to share those results as we have been in preliminary data sharing with meetings to stakeholders, presentations, discussions. Next thing, we've been talking about and trying to work on a development for a grant proposal to extend some of this work, some of the household water quality testing and household surveys, including water security indices, into some of the less studied areas, the rural areas, which Mohammed discussed earlier, have really great need and are kind of outside of the immediate visibility of a lot of NGOs and a lot of groups who tend to work closer to Freetown. And finally, just continued capacity building as we continue this partnership and collaboration. If we're able to continue it beyond this work, we've talked about adding into grants or working into grants, additional capacity building and training for enumerators, water quality technicians, to leverage our expertise at the university level and our partners into their government. So generally some takeaways. We are in the process of conducting an impact evaluation of water kiosks. This work will give us provide a directly attributable impact of the water kiosks on household water quality and water security, which is critical to be able to make informed decision-making in the future regarding water supply interventions in Freetown. There was, secondly, as a kind of nice added side effect of this work, we collected some data that was interesting to the ministry and useful to the ministry within the framework of the work we were already doing. Third, we conducted some capacity building and skill transfer, which I assure you went both ways. I learned quite a bit from the water quality team and the enumerators, and then this context and generally within MICs. And fourth, sort of, the support of the local authority. So we thought it was very important from the beginning to involve a government entity, a ministry or some other agency to partner in this work. We could have hired a firm that is expert in data collection, but in reality, that's not always the most appropriate thing to do. So in this case, we had the opportunity to choose who we were working with, who would collect data. And so we figured the most direct way of providing information to the local government, the national government, was to partner with that entity itself. So yeah, I think we're about to open this up, but I kind of, throughout this work, I kind of been thinking, what are the barriers to shift, these research partners like the Ministry of Water into more primary roles instead of supporting roles. Eventually, I think most people in this room would hope for the day that, the Ministry of Water sets an agenda and is able to, tell us what is needed. And we as universities, we as research, members of the research communities can support them in leading their countries. So with that, I'd like to drop some acknowledgements to my advisor, Evan, who's in the room, and my doctoral committee, the entire Mortensen Center network, many of whom are in this room. our in-country support through MCCU, the Gouma Valley Water Company, the Ministry of Water, and our funding agency, and Millennium Challenge Corporation. So with that, I'll pass it back to Yasmin, and we'll begin our discussion.
Thank you, Matthew. So as we can see from these two presentations, Sierra Leone really leads by example by having a country-led monitoring system and agreements with international and local partners to be able to share that encourages people to share data. And despite these systems being in place, they still have challenges. For example, when it comes to financial tracking and sharing of that financial information. And we heard from Matthew about a successful example of an intervention that was able to share data as well and build global capacity. So sort of going back to the first two questions that we were thinking about before we started these presentations. You know, we as the international community want to hold local governments accountable through monitoring and evaluation efforts. But we should also be asking ourselves, how can we hold ourselves accountable as an international community to sharing those data and to making these data available for decision making at a local level? And how can we better align motivations when it comes to collecting and sharing data as well? So I would like to open, with that in mind, I would like to open this for discussion. If anybody has any questions for our presenters, or anybody has any thoughts or experiences that they would like to share when it comes to the question of holding ourselves accountable to sharing data or aligning motivations when it comes to data collection.
I was just hoping you could say a little bit more about the research design for your impact evaluation. Was it matched cohorts? What was the comparison?
Yeah, so thanks for the question. The research design that I used was a quasi-experimental research design using a difference in difference regression. So we collected baseline data in that research design. You compare before and after in a cohort to a treatment group for those who are unfamiliar. And so before and after is pretty straightforward. We collected baseline data before the start of kiosk operations, and then collected two separate end lines that were combined in analysis afterwards to account for seasonality. The cohort group was selected, so the treatment group was selected by the implementer, so that was outside of our control. That was the Aberdeen and Kingdom communities. And then the cohort group was selected through neighborhood level demographic information and factors that would create a similar water situation. So I limited those communities, the selection of those communities to areas that were on the same section of the bulk transfer network of the water system, similar income levels and poverty levels. And then through clarification, so this information is not super well available down to the community level disaggregation. So that actually was, through help with Mohammed being able to say like, no, this community, while it might show on a map as this is really more of an informal settlement, or this is more high income areas that are not always shown on available data. In addition, so this came down to the selection of Cockle Bay is the community name for a cohort group. In addition, that group was actually selected as a finalist for this program for selection for treatment, but it was removed on factors that were unrelated to the actual outcomes through other things.
Thanks.
So it sounds like you have a successful partnership in data gathering and data sharing and collaboration, which is awesome. So I'm from the University of Victoria, and we're having very similar discussions right now around good research collaborations and supportive partnerships with Indigenous and rural communities in Canada. And I was just wondering if you could speak to like what you think the ingredients are in a successful research partnership. Like, how did you build that long-term relationship in your research for either one of you?
Yeah, so I'll start. I think I could say that Mohammed and I have always seen eye to eye. We've never had any difficult discussions or any problems really. Yeah, you know, so we started this partnership after the lockdowns began. So we met each other in person yesterday. So a lot of Zoom calls at 3 a.m. for me, or, you know, 1 a.m. for him, depending on whether the problem that we were trying to address was on my side or on his. Pretty much no sleep for a couple months for either of us, I think. But a lot of times we ran into issues and, you know, unexpected issues and just had to deal with them. And I think being open to like recognizing that shit happens and you have to deal with it, and it's not necessarily our fault or their fault, whoever us or them is critical. I remember one time we for water quality testing, we used Aquagenics bags, compartment bag testing, which there's usually a regular supply in Freetown. And then when we were ready to collect for the second end line, the stockpile had disappeared. So whose fault is that, right? It's an issue, it's a supply chain failure that happened to happen right when we needed this information, right when we needed these supplies. And so we were able to, just talk through it. Hey, what are all the options? Probably a 3 a.m. call for either you or me, and work through, okay, how can we flex budgeting? Can we pull money from the next budget cycle into this one and send it early to pull this, to pull stock from wherever we could? Or were we able to, I think we ended up doing a mix of buying them at higher rates, which was not expected in our budget, and also pulling some extra supply from some of the rural offices. So just recognizing that things go wrong, and if we're not open between different sides of a partnership to flex where we can and make changes as we can, if we're rigid on things, partnerships fail, I think. So I'll hand it over to Mohammed.
Yeah, I think you have said it all, but one of the key things we need to recognize in terms of partnership is for us to improve the communication. And we have variety and communication, not only in, but also his manager and even Stanford. Just yesterday we met, but we have been talking all these past 2 years, and so 3 years we never met. And but the partnership actually is very, very good, because whenever I call them, even the time zone difference, but they're ready to accept my call. I'm ready to listen to me, and I listen to them too. So if you want to improve the partnership, try to listen to the next opponent and get understanding whatever it's trying to say. And that will help a lot. So far that has helped us, not only Corrad, but even Stanford and even other partners try to listen and get understanding what is on the ground and from their own side, and see how we manage that one. Sometimes it's very challenging for me, even when trying this is what we want, but it's very difficult to be applicable. So it's a very challenging trying to say, oh, this is very difficult, this can't work here. So how do we do this? Well, Mohammed, let us find a way to do it. So see how things work on that way, but try to understand ourselves. That's how we have been doing.
Thank you for the presentation. Mohammed mentioned early on strategic alignment with the national plan. And I just wondered if you could speak a bit more to how the data aligns with the strategic national plan, or how you envision it could support it in future?
Yeah, if you look at our national the development plan in our country, we have a lot of issues with regards to water quality. Not only water supply, but water quality as a right measure. We have a very big challenge in terms of water security issue. So his work is more focused on water quality issues. And since we have that as a problem, we try to really incorporate that to say, oh, this is what we need. Because if you look at our data in 2016, and also the multiple cluster indicator survey around 6, which shows that 97% of our water being contaminated with E. coli. So that shows you that our water quality is a very big issue. So what we need to do is to really get a deep dive into that. We'll get more tangible information for us to address that challenge. So that's why when we partner with the university, we say, okay, now we have outsiders that will give us more information that will also help us to address our challenge. So that's how those information being accepted by the government. Yeah. Because if you just go inside and do that, sometimes when you put that information, you're going to problem. So that's how the information will align, and it's really accepted by the ministry because it's something we all want to really get more details. Yeah. Yeah.
Hi, Mohammed, I'll address this to you in a minute. So there's no one here from MCC. I'm wondering, in response to this work, it's the threshold program is continuing. It's support this kind of initiative with the Ministry of Resources. And if they're not, I think of other bilateral assistance partners that are interested in working with you.
The unfortunate situation, what I've had from our last discussion with the minister and other MCC colleagues, they told me that the compact, because the threshold is finished, and now the compact is more focused on energy rather than water. So that's the biggest challenge we have. So for now, we don't have support from MCC to really roll out this study. And we have put a concept note to really see that to push it forward, because everyone is accepted the result, everyone wants this to continue. But for now, we don't have that support partner to really make sure that we help us rolling out, unless we go back to Colorado, since they are our good friends, maybe they will help us finding other good partners. I hope Matthew and Evans will really support us in doing that. But for now, as a government, we don't have that from MCC.
We had another question here, I think.
Hi, Al Smith with Dig Deep, great presentation and collaboration. I was curious, originally back in the 2015, 2016, or maybe earlier, when you were convincing the government to collect the data and to, disseminate it and create the tool on a national level, what communication strategies would you use to convince government officials that this is important and necessary?
Well, first, actually, how it happened was not only the message came from the donors just after Ebola. Yeah, and the donors say, we have put so much amount, now we want, before we spend more, we want to do this. Yeah, so the government by then was really insisting that, no, just give us the money, now we need to rebuild the country. We have got this Ebola, blah, 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 everything. And the donors say, no, before we spend our money, let us get a stock taking of what we have invested. So that's how it happened, actually. That's what it came from the donors. So and the government said, okay, yes, because we at that time, when the money, we want to really build the country, okay, let us do the stock taking. After the stock taking, they will give us the money. But the donor also go around and say, okay, before we have agreed, but again, The other thing is you need to answer, you need to address key challenges. And that was a very, very difficult question by then. And I can remember just two of us, me and my honorable minister, and our minister look at me and say, "Oh, Mohammed, what will we do? Now I'm going to sign this agreement." I said, "Well, just sign, then we'll address that later." So he signed the agreement. So after collection, the data collection, we need to respond to the donor before we get the presidential delivery fund to rebuild the country after the Ebola. So before we get that fund, we need to really make use of the data to show where there are water points and where there are no water points, where there are really less to be reached. So we need to show them that analysis. So that's where we will partner with a lot of colleagues to really help us doing that analysis. So it was a very quick analysis then. We analyzed that and we gave the result to the donor, to DFID and World and African Development Bank, and then the government get the funding. So when we got the funding, now we go to the implementation. And again, we forget about the data collection. So that's how it happened. So the message for us to convince government actually the challenge for them, as I said earlier, politicians need physical investment. I need to construct water point. That's what the people see. So in terms of data, they don't say it. They want to construct more water points. As people see it, then they will vote for them the next time. So for them, you collect data now. That's not there, basically. So we as a technocrat, we as a water professional, we need to really convince the leader to say, if you invest into data management, it will help you to construct, to make a proper decision in terms of which water point to construct. These are your people. That's what we need to propagate. Thank you.
I was gonna ask, you mentioned that beyond publication, there were other methods that you'd be sharing the results. And I guess I wanted to ask if you could touch on specifics of what those would be and ways to make very high level studies more communicable to not only local governments and partners, but actual local residents.
Yeah, absolutely. So I'll start with local residents. The local residents don't need me to tell them whether or not the water kiosk worked. They either know and appreciate it and love it, or they think it's a useless piece of furniture, I think was on one of the survey responses. But we don't need to tell people whether things work or not. The people who are beneficiaries or users of products, interventions that we do, they generally know if it's useful or not. Things like water quality is a little bit more difficult to share. How do you describe, different levels of risk to somebody who's not knowledgeable about that? That I've left to local authorities. I don't think that I'm the proper voice to share that information. But where I think it's useful from a research or university researcher standpoint is I made sure to set up meetings. We held preliminary results meetings. We held regular meetings during the development and translation of the methodology from whatever stuff I wrote to whatever would be useful in country. So I think, stakeholder meetings, while they might, if they're not written into a program, might seem useless or might seem like an extra step that's not very helpful. But Mohammed talked about earlier, the buy-in, like you need buy-in, and you need all of your partners to understand why the work is important, and that helps them to guide decision-making processes during the work. So I think regular meetings, informal meetings, I think are perfectly fine. Hey, let's just have a conversation about what this means. What did we see in this most recent round of data collection? What are the problems? And results that we mark with asterisks, like, hey, we haven't done the full analysis on, but this information might be useful to the ministry, just general water quality data might be useful to the ministry before the, end impact results are calculated. So I think understanding those needs and being able to share openly, even at earlier stages. And then, I don't know, I kind of lean on Mohammed and say, hey, Mohammed, what's the best way to tell people about this work? Because I don't know, I sit in a desk in Boulder. I'm not at the ministry, sitting at the desk, talking to people who can actually make decisions. So I'll pass it to Mohammed, who knows a lot better than me how to get the word to the decision makers.
To communicate data is very, very tricky, very difficult, and especially data that is very, very controversial based on the outcome. Like when we talk about this, the result, I can remember when we conducted the water quality, and it shows that 97% of our water been contaminated with E. coli. This journalists and other people, we are in a meeting and we talk about this, me and my colleague. And these guys, they just go out and just the way they write it, or we are in trouble by then. It's just that we try to manage it. And also, this Africa content where you have the opposition, you have the ruling. When you as a technocrat say this, the ruling government, they are saying that you want to sabotage them. And the opposition also want to use it to gain more vote. So that's why you need to really manage the communications. And one of the key things to do that, to really, when you want to collect data, make sure that everyone is involved. So whatever the outcome of that data collections, you can't be blamed. Yeah. So just that they will tell you, no, don't release this report, wait next week. So you need to find a platform to really reveal your results. Yeah, you can, some of this critical things, difficult, you will reveal it in the management meetings or in another platform. But don't just go to the media to say, oh, this is the result, these are my findings. You'll be out of the country next 10 minutes. Sorry. Yeah, thank you.
You had a question over here?
Yeah, this is for Mohammed. Thank you both for the presentation. This certainly is a huge undertaking to collect all of this data and create a database that's useful. I wish everywhere I worked had such a rich database like this. But I wanted to ask about the water quality data specifically, especially given the high risk that you found for E. coli. And I wanted to ask how you're planning on using that data to either modify the kiosks or respond by increasing chlorine dose. What approaches are you taking to ensure that the water that you're providing is safe for users?
So from the data, what we got and what we are moving so far now, we try to develop a water safety plan. So we have developed a water safety plan in the country and moving forward for us to implement this water safety plan. But the challenge we are having is the funding, all right, for to really implement the water safety plan. Because as I said earlier, the biggest challenge is the water quality. Now, as the right measure, if you look at our city, we have a poor sewage system. Our pipes are just line rounds. So it's for us to have this water safety plan in implementation, making sure that our people get the safe drinking water. So we have developed the water safety plan, and we have developed the strategy for the implementation. But so far, we still have the challenge in terms of implementing that. So we hope we'll get good friends that will really support the sector in doing so.
I can speak a little bit more to specifically on the water kiosk work. So first off, I would say that the data that I showed earlier, that's from households, not from the kiosks. So the theory of change behind this study is looking at, the impact of water kiosks on households. Okay, so a different part of my extended work and work from MCC, and MCC is looking at closer to the functionality, which I think is more of what you're leaning towards. So we were at the beginning of the project, while the MCC threshold was still ongoing, we were asked to be sort of outside evaluators, so not to be involved in the intervention at all. As now the threshold has closed, we've developed a little bit closer relationships with Guma Valley Water Company, which is sort of the managing entity of the kiosk network. And there's kind of much bigger problems with some of these water kiosks than even the water quality. So like in certain cases, there's pressure drops that prevent the chlorinators from working properly. So we're really looking at bigger, water supply questions for the water kiosk before even delving into treatment solutions. In terms of that, I'm developing some amount of guidance where it is allowable and feasible for me to work closer with the kiosk operators, which was outside of the scope of this work as an external impact evaluation. But I think it's another thing, again, to go back to your question, is how do we get results to people that can actually take action on them, right? And so part of this is, going outside of what's expected of me as a researcher working on an impact evaluation. Once the results are closed and we're able to kind of not bias the results, starting to talk more with the kiosk operators and get the real understanding of like what has gone right, what has gone wrong, so then that could be synthesized and brought back to the ministry level or to the water utility to kind of try to find more real solutions. And in that package, we would look more into treatment and general monitoring to maintain consistent water quality. But those operators are actually quite good at that work. They have experience from other parts of the country. So I don't think that we would actually add too much value there to their credit.
Yeah.
As a follow-up to that question, do you have any paired data on water quality at the kiosk versus water quality once it's transported to the home, and a mechanism to address recontamination during transport and storage?
Yeah, so that's something that I've been thinking about a lot. I'm going to tell you the answer is no. To do that study is outside of the scope of my expertise and the funding and ability for myself to be able to take that on. In addition, there are such significant challenges of operations at the water kiosks that I wouldn't trust spot checking water quality at this stage. So there's kind of higher level challenges that we're addressing in different parts of the extended study outside of this work, outside of this specific impact evaluation, that would make sort of, I don't know how to describe it, that kind of study specifically around the kiosks and the households which it serves, not super useful. There are just bigger challenges at play than that. It's also very well categorized. It's very well understood that these challenges exist, that household water treatment is critical for end users. Even if the water kiosks work perfectly and the treatment in them works perfectly well, it still works on a basis of people having to go collect water, put it in a jerry can that's likely contaminated. There's no system around treatment or disinfection at the water kiosk of containers, and so we have all these issues that are well known but not always addressed by implementers. So in addition to that, part of the work that I'd like to do while writing my dissertation is trying to summarize a lot of this work into sort of a usable and useful guide for implementers in water kiosks. Recognizing that I'm not the world expert on water kiosks yet, maybe, but trying to find whatever information, extract whatever information I can out of any of the partners working on this project, learn from it, synthesize it, and say, okay, hey, if somebody wants to replicate this, these are the things that we know are hypercritical to, prerequisites to success here. So that's a roundabout way of answering your question.
Thank you.
And we have a question from a participant who's online. Gloria Margaret from Kenya wants to ask Mohammed. In the consultative meetings, how did you ensure opinions of vulnerable communities are put on the table, specifically women, PLWD? Could you please share some practical examples that you used for educating the public?
During our consultative meeting, what we'll do was really look at the compositions of the participants itself. So we try to make sure that everyone was involved. All the participants from the rural level and to the national. So the selection of participants makes sure that we really covered most of the people, most of the vulnerables, and also the one that are really in the issue making. So that's exactly what we did into that consultative meeting, for them to really, we meet and we discuss in that meeting for us to agree on what we really need to really monitor. So we brought participants from the district, from the rural, the district, the chiefdom and the district, and at national. So that's the compositions we really gather at that time. And during our discussions, so we'll try to listen to them also to get what they want and what information they want. And one of the critical things that came out from that meeting, I remember, they said, okay, now we have agreed to do this. You are going to collect the data. What is going to be our feedback? That if whatever you are getting from us, we need to get a feedback to the rural. And we are not yet addressed that one. Yeah, and it's also something we need to consider as when we are collecting data. We need to give a feedback to the respondent. Whatever you have collected, like the question you asked, you need to give them a feedback. But the mechanism we are using now is not adequate in terms of giving feedback. As I said earlier, we are having an annual WASH conference, and this annual WASH conference is a bigger forum. We are just talk, we are agreed. But for them also to say, okay, these are the information we give to you, but we don't accept A, B, C, or we agree to it. So we need also to go with a data dialogue, yeah, with the community and with the chiefdoms for them to also discuss with them. So I think that's also something we need to consider correctly. Yeah.
Great, and I also had a quick question for you, Mohammed. You mentioned earlier, you were talking about the agreements that you have with organizations, where you ask them as part of that agreement to share the data as well. What happens in reality? Do people abide by these agreements and share the data with you? And if so, how do you ensure that these agreements are enforced?
Honestly, it's still a challenge for us. It is something we are working on. It's a very big challenge because we also have our own issues as a government, as a ministry, and sometimes it's affecting some of these policies we laid out. Yeah, and when there are changes in the governance, and it creates a lot of issues. So sometimes this particular leadership want things to happen the other way around. So that also affects some of these administrative processes. But so far, what we have laid as a policy is for the agency, the implementing agency, to really share their data to the ministry. So far now, we have an NGO that is doing things. We still are continuing to engage him to also follow that suit. Yeah.
Great. And also, just also going back to both of you, what are your, based on your experience, what are your recommendations for the international community when it comes to holding ourselves accountable to sharing those data for decision making, and how can we make these data useful when it comes to ensuring that it can be used for decision making? What are your recommendations based on your experience on that?
Well, for me, one of the things I'm also putting into the international partners is for them us to really see that they strengthen the local capacity of the local for the ministries to really do that in data management. Because why I'm saying this from experience, when the donors say we want this to happen, it happens. Yeah, but when they just look at it as something like, oh, okay, this is what the government says, let us give them the money. It's very difficult to happen. So if the international partners say, okay, we want the data, we want governments to do this, to continue the data, continue this, whatever support we are given to the government, let us say if 5 or 10% is going for data collection, let it be for data collection. So we need to enforce that. We agree that say this is a law or it's a policy. But if you just go, okay, I have this funding, I have this project, and give it to the government, so okay, then we'll go back and say, oh no, we are doing monitoring. We'll respond to yes, we are doing this, but it's not applicable, it's not happening. So if we are doing that, and then if governments are not using the data, the partners, the donor will use the data, because since the data is coming in, then you will use the data. Okay, we have this project, we have this money, but based on the evidence, based on the data we have, we realize that this district is unserved. So we are going to this district. Even the minister say, no, don't go to this district because maybe he has its own idea. But based on the evidence, based on the data you have, we'll say, no, we want to support this district. And definitely, trust me, he will agree as long as you have the money. He will agree, so okay, go ahead and do that. Yeah. So we need to look at that angle in terms of supporting the government to say this. We keep on saying evidence. Wherever any meeting it goes, information we have, we need to do data collection, we need information. But in the process of doing that, what are the things we need to put forward to do that? So that's what we need to enforce.
So I think one of the big things we need to think about is who are we accountable to, right? So naturally we have to respond to our funders. That's how this works. We have to, as grad students, redo whatever we're asked to, write a dissertation and get those letters next to our names. We all have responsibilities in our jobs that we need to do. And we sometimes, I think we all forget the big picture for the specific thing that we were tasked to do, right? Or the specific thing that we proposed to do. A little while ago, I defended my comps, and one of my committee members who's in the room right now asked me probably the hardest question in my comps: who do you see as your client? Who do you serve in this project? So I gave a really nice response, linking all the different partners together and so then the response that I got from this committee member was, who is your client? Who do you work for on this project? Calling me out on it. And I think it's hypercritical that we think about these things. Who are we there wherever there is to serve? Is it the community? Is it a local government? Is it simply our funders? I mean, do we trust that the processes that led us to our projects are, perfect and without flaw? Or do we do we think about how within our ability to work within work within the opportunities we have, can we make data more available, more useful, more actionable? And to that note, I give a little anecdote. When we were visiting Sierra Leone, my team, who some of which are in this room as well, we were tasked to pilot some sensors that eventually the next generation would end up on to study the water kiosk monitor functionality. And when we shared this work with Guma Valley Water Company, who manages the water in Freetown, they were like, wow, this is super useful technology. Can we put this on our reservoirs? You know, can we put this on our bulk transmission system? Because we don't currently, what we do, they told us, is we have a guy look in the hole, count how many steps down the ladder the water level is, report back, and we make decisions accordingly. So having a water level sensor data on this critical piece of infrastructure would be awesome. It was outside the scope of our work to do that. Yet we had flexibility on where we installed these pilot sensors. The kiosks weren't built yet. You know, we kind of were able to put them on whatever piece of water technology, water infrastructure where water went up and down to test the technology work. So we made a case to our funding agency that, hey, this water reservoir is somewhat more different than what the kiosk will look like. You know, it's a massive water reservoir instead of a 10,000 liter tank. But you know, the way that the technology works, this should be a very similar test. And instead of this data being collected from, you know, realistically a useless piece of water infrastructure somewhere in the city where the operator isn't going to pay attention to the results, why don't we serve the water utility in the meantime, collect the data we need, and just change our plan a tiny bit. And that data has been useful to the water utility. Actually, they just gave me a call right now, which I missed, but you know, so thinking about how we can work within our roles and responsibilities and not get ourselves fired or like, you know, work against our institution's needs, but where can we flex within our own abilities, within our own responsibilities to serve whoever it is that we believe that we're there to serve. Because it definitely shouldn't be ourselves. You know, research shouldn't be for the sake of research. I think it should be definitely applicable and actionable in any way that we can make it.
Thank you. And on that note, I hope we've given you food for thought and encourage you to think differently when it comes to collecting, using, and sharing data. And how can we better align our motivations behind collecting, using, and sharing data so that we make sure that it is used for decision making by LMITs and local communities. And with that, I would like to thank our presenters, and thank you so much everyone for attending. Hope you have a great rest of the week.
Yes, sir. Yes, sir. Well.
Give me a minute.
Yeah.
You're like, I recognize. You. We actually met. I think. The last time. Yes. That's not. Actually. I gotta go. But yeah, number one. Are you? Thank you.